Assalamu alaikum warahmatullahi wabarakatuh. Today I'm gonna discuss one of the head and neck lectures for level 1 students. It's about the major vessels of the neck. I'm Dr. Dalia Saleh, Professor and Head of Anatomy Department, Mansour University. I'm gonna cover the following objectives. First, what are the major arteries in the neck? We have the carotid system or the carotid arteries and the subclavian arteries. The carotid arteries include the common carotid, the external carotid, and the internal carotid arteries. Also, we will discuss the major veins of the neck, and we have the jugular venous system, but I'm going to focus on the two jugulars, the internal jugular vein and the external jugular veins. To begin with the arteries, in this diagram you can see the heart inside the thoracic cavity or the thoracic cage, and the big artery that comes out of it is the aorta. It is divided into three main parts: ascending part, the one that ascends upward, and then the arch of the aorta, and then descend downward as descending aorta. The major veins of the neck comes from the arch of the aorta. They are three in number. Eventually they supply the neck, the head, and the upper limbs. The one that will supply the upper limb is called the subclavian artery because it is related to the clavicle. It lies beneath the clavicle. That's why it's called the subclavian artery. The one that will go up in the neck to supply the neck and the head is called the common carotid artery. In the left side, they arise separately from the arch of the aorta. So we have the left subclavian and left common carotid. But in the right side, the right subclavian and the right common carotid unite and form a trunk called brachiocephalic trunk. And again, brachium means arm and cephalic means head. So brachiocephalic artery is the artery that will later on divide into subclavian to supply the brachium or the arm, and the common carotid that will supply the head or the cephalic part of the body. I'm gonna start now with the common carotid artery. The common carotid artery arises, the left common carotid, it arises directly from the arch of the aorta here, the middle one here, while in the right side it arises in common stem with the right subclavian artery in this branch that is called the brachiocephalic trunk or brachiocephalic artery. So the brachiocephalic artery will split into right common carotid and right subclavian, while the left common carotid arises directly from the arch of the aorta. For the course and relations of the common carotid artery, the common carotid first enters the neck behind the sternoclavicular joint. This is the menoprium sterni, or the first piece of the sternum here, and this is the clavicular notch. So in this area should be the clavicle. So this is the sternoclavicular joint. You can see beneath the sternoclavicular joint here lies the common carotid artery. So the common carotid artery enters the neck behind the sternoclavicular joint and then pass within a sheath of fascia that wraps around it and also around the vein lateral to it. This is called the carotid sheath, and inside the carotid sheath you can see that it lies medial to the vein. And then while it goes upward in the neck, it lies lateral to the viscera of the neck, or the viscera of the neck lies medial to it. And what do I mean by the word viscera? I mean the organs that lies in the neck, like the larynx, the trachea, and the thyroid gland, and posterior to them lies the pharynx. Posteriorly or the posterior relation of the common carotid artery. This is the common carotid artery. You can see posterior to it lies the cervical vertebrae. So it is related to the lower four cervical vertebrae, but it is closest to the C6 or the cervical vertebra number 6. The common carotid artery does not give any branches in the neck. It just terminates at the level of C4 or roughly at the upper border of the thyroid cartilage into two terminal branches, external and internal carotids. For the external carotid artery, as its name tells, it is external. This means that it will supply structures outside the cranial cavity. So it will supply structures in the neck and also structures outside the skull. So its origin, like we said before, it originates as one of the two terminal branches of the common carotid artery at the level of the fourth cervical vertebra or at the level of the upper border of the thyroid cartilage. This is the thyroid cartilage, or this is the larynx, and this is the thyroid cartilage. So this is the upper border of the thyroid cartilage, and you can see that the external carotid artery arises at this level. Then it passes in the neck, between the muscles of the neck. Simply we can put this muscle, which is the posterior belly of digastric, it lies here, and another one lies in this level. It's called omohyoid, and this large muscle on the side of the neck is called sternomastoid. So these three muscles form a triangle. They bound a triangle like this. This triangle is called the carotid triangle because you can see and feel the pulsations of the carotid vessels in this triangle. So the external carotid artery ascends in the carotid triangle of the neck and then passes deep or beneath the posterior belly of digastric here, and then go upward. When it goes upward, there will be a space between the mandible and the mastoid process. This space is filled with this big salivary gland, which is called the parotid gland. So the external carotid artery enters within the substance of the parotid gland and lies deep inside it till it reaches the level of the neck of the mandible. Here it will divide into two terminal branches. The external carotid artery at the level of the neck of the mandible will divide into two terminal branches. The superficial temporal artery, this big one that lies over the temple here, this is the superficial temporal artery, lies over the temporal bone and the side of the skull. And another artery that lies deep to the temporal fossa, at the infratemporal fossa, and lies close to the maxillary bone. This is called the maxillary artery, this one. Okay, so again the external carotid artery terminates at the level of the neck of the mandible into two terminal branches, superficial temporal over the side of the skull and maxillary close to the maxillary. The superficial temporal artery will supply the scalp, will supply the face through the transverse facial artery, and will also supply the ear. While the maxillary artery will give branches that will enter through the foramina of the skull, like foramen spinosum, and supply the meninges or the outer coverings of the brain. It will also supply the ear. It will also supply the mandible and the teeth of the lower jaw. It will supply the muscles of mastication, the muscles that make you move your jaw and chew the food, and will supply the nasal cavity and the upper jaw and the teeth of the upper jaw, and terminates as the infraorbital artery, the one that you have studied in the face before. What about the branches of the external carotid artery? Like I said, they supply the portion of the head and neck and face, of course, outside the cranium. That's why it is called external. It has many branches. 3 lies anterior, or comes from its anterior aspect. The one that will go upward into the face, we call it the facial artery. The one that will go downward and supply the thyroid gland, we will call it the superior thyroid artery. And the one in the middle that will go and supply the tongue, we call it the lingual artery. Also, we have 2 branches coming from the external carotid artery from its back. One will just lie behind the auricle, we will call it the posterior auricular artery, and another one will lie over the occipital bone, we will call it the occipital artery. Then we have a deep or medial branch. You cannot see it in this diagram because it lies behind deep to the external carotid. It is called ascending pharyngeal. It goes upward on the side of the pharynx. That's why it's called ascending pharyngeal. And then the external carotid artery will give us 2 terminal branches at the level of the neck of the mandible, the superficial temporal, the one that goes upward, and the maxillary artery that will go towards the maxilla. The other branch of the carotid system is the internal carotid artery, and from its name, internal means that it will supply structure inside the cranial cavity. For the origin of the internal carotid artery, we said before, same like we said in the external carotid artery, it is one of the 2 terminal branches of the common carotid artery at the level of the 4th cervical vertebra, or at the level of the upper border of thyroid cartilage. At its beginning here, it is related to 2 important structures. One is called the carotid sinus. Sinus means dilatation, like a pocket. So the carotid sinus is a dilatation at its beginning and contains baroreceptors. Baroreceptors, specific types of receptors that will detect changes in the blood pressure. And also it is related to a body. It's called the carotid body. It lies deep to the carotid sinus and has chemoreceptors. It has receptors that will detect the chemical changes of the blood, and they are both supplied by the cranial nerves, glossopharyngeal. For the internal carotid artery, like you see in this diagram, the carotid artery has first a straight course and then wavy course while it gets into the cranial cavity. The first part of the internal carotid is the cervical part because it lies in the neck, and then this wavy part of the artery, number 2, 3, 4, lies within the pitreous part of temporal bone inside the carotid canal, and then now it enters the skull, so it will go into a place or a sinus called the cavernous sinus. So number 5 and 6 refers to the cavernous part of the internal carotid artery, and then after it finishes its course inside the cavernous sinus, it will go outside it in part which is called the supracavernous part, and finally it will terminate next to the optic chiasma, or crossing of the optic nerve. It's called the this part, number 8, will be the termination of the internal carotid artery. Anyway, from number 1 to 8, you can see that first it has a straight course in the neck. It's called the cervical part, and then get in a wavy way either inside the vitreous part of temporal bone, or inside the cavernous sinus, or outside the cavernous sinus, and finally terminates beside. Okay, you can see it in this diagram. This is the common carotid. The one with the branches will be the external carotid, and the one with no branches in the neck will be the internal carotid. It passes in a straight way first, and then gets inside the cranial cavity through the bit as part of temporal bone, and you can notice that it passes into a wavy course and then terminates inside the cranial cavity. Okay, this is another diagram to show the branches. In the neck, it has no branches. Inside the cranial cavity, it starts to give branches to the eye, to the middle ear, to the pituitary gland, and to the brain. This one will supply the eye. The ophthalmic artery will supply the eye. It will give hypophyseal branches to the pituitary gland. It will give tympanic branches to the ear, and finally will divide into two terminal branches to supply structures here inside the brain. The other major artery which is related to the neck is the subclavian artery. It lies below the clavicle, that's why it is called the subclavian artery. And its origin is very simple, like we mentioned in the carotid artery, common carotid artery before. The left one will arise directly from the arch of the aorta here, lateral to the left common carotid, and the right one will arise in common with the right common carotid from this trunk, which is called the brachiocephalic trunk or brachiocephalic artery. For its course and branches, it lies in the root of the neck, and eventually it will give many branches that will supply the posterior part of the brain, the deep parts of the lower neck, the upper surface of the chest wall as well. So this diagram can show it. This is the subclavian artery here, lies beneath the clavicle, and the clavicle is not seen in this diagram, so the clavicle should be above it. That's why it's called the subclavian artery, lies at the root of the neck. It gives many branches. Some of them will go upwards, like this one, to go inside the skull and supply part of the brain, or gives branches that go downward to supply the upper part of the chest, and it will also give branches that will supply the lower part of the deep part of the neck here. For the veins or the major veins of the neck, we have the jugular system of veins. I will focus only in two, external and internal jugular veins. The external jugular vein, we have mentioned it before in the face. It is formed behind the angle of the mandible or the angle of the jaw by union of two veins, the posterior auricular, the one that comes behind the ear, and the retromandibular vein here. And together, when they join together, they will form the external jugular vein. The external jugular vein will descend in the neck across the sternomastoid or superficial to the sternomastoid. That's why we call it external jugular. Again, this is the sternomastoid and the vein lies superficial to it. And then go downward and drain or terminate at the subclavian vein at the root of the neck. The internal jugular vein, internal means inside. It is a large vein, larger than the external jugular, and receives blood that comes from the brain, face, and neck. It starts as a continuation of a big vein inside the cranial cavity. It's called the sigmoid sinus. It leaves the skull through the jugular foramen and then appears in the neck and descends deep to the sternomastoid. And in the neck, we can see it lateral to the carotid artery inside the carotid sheath, and then it descend downward deep to the sternomastoid and join the subclavian vein. For its tributaries, it receives many veins from inside the skull, like the inferior petrosal sinus. It also receives the common facial vein, the pharyngeal veins, the lingual vein that drains the tongue, the superior thyroid vein, and the middle thyroid vein. This is the end of my presentation, and I hope you enjoyed.